Hello everyone, today we'll be discussing endometriosis. Endometriosis is a chronic gynecologic disease that is characterized by the development and presence of histological elements like endometrial glands and stroma in anatomical positions and organs outside the uterine cavity. Etiology. There are several developed theories about the etiology of endometriosis based on the logical sequel relating to the severity of symptoms with the stage of the disease. However, when we look at the proposed models, none of them can fully explain the range of clinical manifestations of the disease. The most widely plausible theory is the Sampson's assumption that states that the viable cells in the peritoneal fluid with retrograde menstruation can implant, grow, and infiltrate the peritoneal cavity. So, retrograde menstruation is a term that is used to describe the reflux of blood backwards from the fallopian tube to the peritoneum during menstruation. This is a phenomenon that is quite common in a large proportion of women of reproductive age. Pathophysiology of endometriosis. The understanding of the pathophysiology of endometriosis remains incomplete in many aspects, and there is not a coherent suggested theory that explains all different types of endometriosis. So the same thing under the pathophysiology, we talk about the Sampson's theory that talks about retrograde menstruation that I explained earlier. History and physical examination. The peak of the disease incidence is greater in women between 25 and 29 years old and is lowest in women over 44 years old. And we need to know that the prevalence is higher in whites than in African Americans. The clinical presentation of the disease differs in women and may be unexpected, not only in the presentation but also in the duration. So, clinicians usually suspect and are more likely to diagnose the disease in females that present with the typical symptomatology, such as dyspareunia, which is painful sexual intercourse, pelvic pain during menstruation, dysmenorrhea, pain in urination, dysuria, pain during defecation, which is dysphagia, and or infertility. And when we talk about the nature of the pain, it's usually characterized as chronic, cyclic, and progressive, and the pain is exacerbating over time. Then, furthermore, some women also suffer from endometriosis, hyperalgesia. This condition indicates neuropathic pain. Evaluation of endometriosis. The diagnosis of the disease is usually delayed for an average of 4 to 11 years from the onset of symptoms. This delay is attributed to the non-existence of a pathognomonic test or biomarker to detect the disease, but also to the diversity of symptoms that could be considered physiologic response during menstruation, such as pain and discomfort, but also to the wider range of reported symptoms that overlap with other GI or gynecologic causes. Positive family history, pelvic pain, benign ovarian cysts, pelvic surgeries, and infertility issues, tenderness on vaginal examination, palpable nodules in the posterior fornix and nexal masses, and immobility of the uterus. However, the gold standard diagnostic tool for diagnosis of endometriosis is laparoscopy. Treatment or management of endometriosis. So, treatment of endometriosis is broadly classified into two main categories, which is pharmacological and surgical. Currently, there isn't a specific drug that could inhibit the progress of the disease rather than hormonal and non-hormonal agents. These are used to alleviate the symptoms and increase the fertility rates. An empirical medical therapy can be instituted for women with endometriosis symptoms, such as pelvic pain, even without a histologic confirmation. The first-line pharmacological therapy for management of endometriosis is NSAIDs, progestins, or combined hormonal contraceptives. Then, GnRH analogs for the suppression of endometriosis-related symptoms, Surgery should be considered in cases of superficial endometriosis that is unresponsive or with contradictions to medical treatment. When laparoscopic surgery is performed, the recommendation is to excise all the endometriotic lesions and adhesions. Complications of endometriosis. The main complications of endometriosis include infertility or subfertility, chronic pain, and other debilitating persisting symptoms. These are entitled in a wide range that include dysmenorrhea, dyspareunia, and dysphagia. But endometriosis can also cause a decrease in the quality of life of patients. Complications of surgical procedures, anatomical abnormalities due to possible adhesions, bowel or and bladder dysfunction, and in the case of ovarian endometriomas can even lead to the development of cancer. So that's all about endometriosis. If you like the video, please like, subscribe, and comment. Thank you.